Okay, so welcome everyone. Welcome to the Ethics and COVID-19 webinar series. This is our 29th webinar. This is wonderful. And these webinars are co-sponsored by the Office of Research Excellence at the School of Public Health at the George Washington University, and also in collaboration with the Bioethics Interest Group, and also the Research Ethics Capacity Building initiative between the George Washington University and the University of Science, Techniques and Technologies of Bamako in Mali, and also a Research Ethics Capacity Building program between the George Washington University and the Kinshasa University in the Democratic Republic of the Congo. Welcome everyone. My name is Paul Ndebele. I'm an assistant director in the Office of Research Excellence. I also teach in the Department of Global Health. I'll be serving as the moderator during this webinar. So today we are focusing on the Latin American region. We want to discuss what is happening within that region, focusing on the ethical issues related to COVID-19. We've got two great panelists who know about all the issues that are happening within the Latin American region. So as they'll be giving their talks, please feel free to use the chat function to comment and also to raise questions. Once they are done with their talks, we'll have time to go through those questions and comments, and they will be happy to respond to those questions. So let me now introduce our first panelist. Her name is Dr. Carla Saenz. I have known Carla for more than 20 years. So it's great to meet Carla. So Carla is the Regional Bioethics Advisor at the Pan American Health Organization, and she is responsible for PAO's regional program on bioethics, which supports the bioethics to countries in Latin America and the Caribbean. She is an elected fellow of the Hastings Center, and she has authored numerous publications in the area of bioethics, and she has also co-edited a book on public health ethics. Carla has been responsible for the development of PAO's Zika ethics guidance, and is in the steering committee of the Global Forum on Bioethics in Research. So we serve on that committee together. She holds a PhD in philosophy from the University of Texas at Austin. And before joining PAO, she was at the Department of Bioethics at the Clinical Center at the NIH. So over to Carla.
Thank you so much, Paul. It's so great to be in this webinar with such good, close friends and collaborators that I have known for so long, like you and also Sofia. So I'm going to talk to you today very briefly about what has happened in the region of the Americas, what we have done, and by that I mean PAHO, but also our member states. Then I'm going to discuss briefly what I think has been the most salient ethical challenge during the pandemic in the region. And to close, I'm just going to highlight one prominent lesson of the pandemic from that challenge and our overall experience, and tell you a little bit of what we're doing, as it were, post-COVID to improve ethics in future emergencies. So what has happened? The pandemic has brought bioethics to the forefront. The ethics of research, the ethics of research with human subjects, the ethics of public health intervention have been a matter of discussion in a way that hadn't happened before. So research and public health ethics had acquired a lot of prominence And the discussions about public health ethics have included discussions about allocations and about allocation of scarce resources for care. And I'm just going to say as a side comment that one of the challenges that we're having is that clinical ethics frameworks have been incorrectly used to discuss, to guide the ethics of allocation of scarce resources during the pandemic. But overall, everybody has been discussing what is the right thing to do in the context of the pandemic. Is it okay to require vaccination? Is it okay to do research with pregnant women for vaccines? And one thing has been really interesting. It's been clear that legal discussions do not satisfy the ethical concerns that we have. The question is not, is this legally acceptable? The question is this the right thing to do? And that's why that's exactly what has brought bioethics to the forefront. But it has been not just the forefront of the discussion of people in the academia or health authorities, but it has brought bioethics to the public. So partially in response to that, PAHO, Pan American Health Organization, with its regional program of bioethics, has been doing a lot of work. So we've issued ethics guidance on a number of issues, many of them related to research with human subjects. We issue ethics guidance, but we work very closely with health authorities to implement such ethics guidance. And there's been a lot of action in our region to implement the guidance that has been issued. And I included in the chat the website of PAHO's bioethics program, so you can see this guidance document. And I'm going to be sharing some websites with you as we go. So, but the other interesting thing is that we have, because bioethics has been brought to the front, not just of health authorities and academia, but also to the public, we, PAHO, have been producing tools on ethics for the general public, which is something that we had not done before. We have been developing animated videos, infographics, social media resources on public health ethics and research ethics, given that the wider public was interested and involved in the ethics discussion. So I said I was going to talk briefly about what I thought was the most salient ethical issue that we have faced in the region. And that, I would say, is the ethical challenge posed by the emergency use of unproven intervention outside of research settings. And let me explain why this is a problem. When you go to the doctor, when you when care gets delivered to you, you receive something that is proven, that has already been established before, that is safe and effective, okay? So outside of research, in the care setting, you receive something that is proven already. It is in the research setting when we find out, when we prove things, when we find out if something works or doesn't work. So in the research settings, because we are trying to prove something, because we do not know if that intervention is safe or effective, we ensure a series of safeguards for participants, for research participants. What we have seen is that interventions that were not yet proven, that we did not know whether they were safe or effective, have been given to the population, but outside of research settings, despite the fact that they were not proven and without all the safeguards that come with a research setting. So this has been an ethical challenge that we've encountered, and one that is certainly not new. You may remember it was a topic that was discussed during the Ebola outbreak in West Africa in, God, when was that? 2013, 2014. It feels like that was ages ago. So WHO issued ethics guidance in that context. And what we did at PAHO was to work on that guidance and clarify that and make it more, make it easier to implement in the region. Pretty much, so there are situations in which it may be ethical to give an emergency use of, to use in an emergency an unproven intervention outside a research setting. And there are circumstances in which it might be ethical, and it depends on 4 criteria. A criteria of justification that has to do with the risks and benefits assessment, a criteria of ethical and regulatory oversight, a criteria of informed consent, and a criteria of contribution to the generation of evidence. Because even if this is outside of research, we have the moral duty to learn something that we're giving to people because we're hoping it may help and we are in an emergency situation. So this ethical framework is known as MURI framework, because the name acronym that got coined during the Ebola outbreak wasn't sufficiently known in our region. Probably I would say it was not sufficiently known worldwide, and we have developed a guidance document that I'm going to share with you now, and also worked with member states. So if they consider the use of an intervention that is unproven outside of a research setting during COVID, that they adhere to these ethical guidelines. So I'm going to put in the chat right now the MURI ethics guidance for you. But this has, as I said, this has been a challenge because, well, in many cases, we all over the Americas, we have seen that interventions have been used during COVID, for COVID, outside of research settings, while being unproven and without adherence to this ethical guidance. So this is a learning lesson for all of us. And I just want to highlight one point that is very striking about this ethical challenge. So the ethical challenge that we have is that unproven interventions have been given to people, to patients, to populations outside of research settings, okay? The challenge that we have encountered is that when that has happened without adherence to the ethical criteria, and in particular, without adherence to the first criteria, which is a criteria of justification, that hasn't gone well, okay? It hasn't gone well, but interestingly enough, the critical judgments in response to that do not pertain to the use of an intervention outside of research, but are critiques that research as an institution has received. So when retrospectively it's been assessed that that was not the right thing to do, the claim has been made that that was poorly conducted research. Well, that was not meant to be research in the first place. So what was a public health intervention in the majority of cases that was not conducted in adherence to the ethical standards, to the adequate ethical standards, was judged as poorly conducted research by virtue of an unproven intervention being used. So the research institution has suffered. Entities that oversee research have suffered as a result of that, which brings me to an important lesson. We have seen ways in which research and public health intertwine in this pandemic that I don't think we had envisioned before. So I was just describing a way in which public health practice impacts research, impacts the perception that that research is not conducted ethically. But at the same time, we've seen the other path as well. We've seen that the ethics of research, the perception that research is not being conducted ethically, impacts the reception of a public health intervention. And that we have seen with COVID vaccines. When people think that a research should not be trusted because it's not ethical, they don't trust the products that result from that research. So it's a huge lesson for us. And just as final words, we are at PAHO working with Sofia's support on an ethics guidance document that aims at catalyzing ethical research in future emergencies. When we try to build on this, on our experience, try to reflect on the lessons that we have experienced collectively as a region. And well, we have identified that there are lessons that are for emergencies. There are lessons that go beyond emergencies. We've learned things that that should apply even to non-emergency settings. And I'm going to finish now. I'm just inviting you all, in case you're interested, to participate at our webinar on Friday, when we're going to discuss our preliminary conclusions, our preliminary recommendations to get the input of the region. And as I said, while this is based on the experience mostly of Latin America and the Caribbean, I think it has relevance for low and middle income countries in general. And Sofia will be a panelist in that discussion too. And I also shared the link of our mailing list, our research ethics mailing list, so you can be more involved with the work we're doing in the region. Thank you very much.
Thank you very much, Carla. You were actually talking at that higher level with a view on what's happening within the region, and particularly you shared with us some of the important strategies that you adopted as PAHO in terms of guiding the countries as they were going through the COVID-19 pandemic. And interestingly too, you also highlighted issues that the region came across in terms of clinical ethics, public health ethics, and also research ethics. Last week, in one of my classes, I was talking about research during public health emergencies, and I actually made use of the guidance document that you produced with 10 points, and encouraging that research should actually be conducted during these difficult times, so that as society we are able to address the challenges that we are facing. So thank you very much for sharing all those resources. We are going to have questions afterwards, some of them directed at you. Okay, so now we want to move over to our second panelist. So I'm happy to introduce Dr. Sofia Salas, who is a medical doctor and a full professor at the Center of Bioethics at the Faculty of Medicine, Clínica, Alemana, Universidad del Desarrollo. So since 1994, she has participated as a member of the local IRB at the Faculty of Medicine at the Universidad Católica, and also at the Universidad Diego Portales. That is from 2013 up to 2018. And Sofia teaches research ethics at pre and postgraduate levels, and also conducts bioethics research on different topics. During 2014, Dr. Salas was awarded a training program in research ethics at Flasco in Argentina. And this is a program supported by the Fogarty International Center at the NIH. She is currently a member of the ethics department of the Chilean Medical Association, and also chair of the National Commission for Research Ethics. And in 2018, she was awarded the Premio de Ética by the Chilean Medical Association for her work on conscientious objectors in Chilean medical education. Over to you, Sofia.
Thanks, Paul, and greetings to everybody attending this important webinar. I'm very glad to be here. My agenda, I will give you a brief information regarding Chile and its research organization. I will do a SWOT analysis of Chilean Research Ethics Committee during the pandemic. And as an example, I will share with you some insights about the ethical review of vaccine trials during the pandemic. Probably most of you know that Chile is a cultural and ethnically diverse country. We are nearly 19.5 million inhabitants. Our gross domestic product is a little bit more than 11,000 euros, and nearly 6% of our GDP goes to health expenditure. More important, our genetic characterization is about 45% Native Americans, 52% European ancestors, and 3% African. So as similar to other regions in Latin America, this diversity of genetic composition of the population makes it an ideal scenario to have clinical trials ongoing in our region. In Chile, we have quite a lot of laws related to research ethics that have been very important. From 2006, it is compulsory to review every research project with human subjects. And also the accreditation of Research Ethics Committee is mandated by law. Currently, 64 registered IRB are along the country. And those are some positive issues. There are some restrictions for research with subjects who are unable to provide informed consent due to physical or mental cognitive impairment. And there are also regulatory protections concerning compensation for research injuries. And quite recent law says that it's post-trial access to research treatments without cost as long as there is clinical indication. In recent years, this is the trends in clinical trials in Chile. Nearly 96% of the clinical trials using drugs are sponsored by international pharmaceutical companies in our country. And 73% of the clinical trials in Chile are phases 3 and 4. And we have observed a slight reduction in the number of clinical trials since the year 2015. It's difficult to determine which is the reason, but maybe more restrictive laws could have an impact. And also, we have to recognize that there has been an improvement in research capacities in other countries within LATAM region. What about our strength, weakness, opportunities, and threats for Research Ethics Committee during the pandemic? A slight overview. From my point of view, it's a strength that we have a long research experience in the country. Most of our researchers have been trained abroad as well. We have a clear regulatory framework, and there are quite a lot of research ethics committee along the country that have completed the accreditation process. What some weakness? There is no national or regional research ethics committee network, so it's difficult to communicate in a timely manner within each other. There is no updated information of ongoing clinical trials in the region, and multiple reviews for the same protocol delay the whole process. But there are some opportunities. Pandemic learnings should inspire future agenda, as Carla said. We need to work in mutual recognition of the Research Ethics Committee, so what one review should be used by the other committees. And we need to establish a centralized information system for clinical trials. And we have some threats. We still have some bureaucratic obstacles for the operation of Research Ethics Committee. Also, the research agenda is set mainly by the industry, not really by our local needs. And there is little community engagement, which undermines at the end the research credibility. Which are additional challenges for the Research Ethics Committee in LATAM? Well, as I mentioned, we don't evaluate community engagement as part of the review process. I feel that sometimes IRBs are more interested in reviewing the consent document rather than the consent process. And IRBs usually do not consider as part of their duty to engage in public campaigns or to foster relationships with different stakeholders. Which were the ethical challenges of new vaccines during the pandemic? Well, first, why are vaccines trials during pandemic so special? Well, they were done in healthy population. There was a need of fast results. There was frequent new data coming up that kept on making changes on the protocols that had already been approved. And whatever the trial outcome, it will have global impact. At one moment in Chile, we had at least 6 different vaccine platforms clinical trials ongoing. Most clinical trials were multi-center in different cities and regions. And we had additional trials booster doses after 2 doses of Sinovac, and also pediatric trials with Sinovac vaccines. So we faced the issue that we needed an ad hoc research ethics committee because we were receiving various phase 3 protocols of new vaccine candidates at different centers and in different regions. And we had no uniform criteria for review or approval. And even though Chilean law authorizes multi-center studies to be reviewed by one single research ethics committee, that was insufficient for follow-up. So it was evident that there was a need to make more general recommendations that could be applied across different IRBs. Therefore, the Ministry of Health appointed an ad hoc ethics committee specifically for review of vaccine COVID-19 trials. And it was, they were appointed representatives of all accredited research ethics committee that were reviewing vaccine trials and members of the National Advisory Committee for Research Ethics, plus a community representative. We met every other week for nearly 2 months, and the protocol of the vaccine trial was presented by the local PI and or the chair of the research ethics committee that received the protocol. We did several recommendations in terms of a fair participant selection, about the consent form and the consent process. We spent quite a lot of time discussing the risks and benefits of vaccines during pregnancy and lactation. What about the insurance policy, the quality of the center and the researchers' qualifications to ensure participant protection. And it was evident that there was a need of an external data monitoring system. But it did work, and it soon came out local data about the vaccines that we were trying here in Chile. And most probably without this initiative, we wouldn't have been able to have vaccination for everybody who wanted at a very big scale. So which are the future steps? And I'm finishing now. Well, before next pandemic, we need to strengthen the research ethics committee autonomy and collaborative work within the country and the region. We need to improve the use of information and communication technologies within the research community. We need to improve community engagement for the whole research enterprise and a better involvement of each of the stakeholders. And last but not least, we need to professionalize the work of the research ethics committee, not only with more resources, but also with people more trained and with dedicated time to do this very important job. So thanks very much indeed for this invitation. I will stop sharing.
Thank you very much, Sofia, for sharing with us the Chilean experience. And you provided us with a wonderful background with regards to the country and Chile, and also even the regulations that are in place to guide research involving human subjects. But you highlighted a very, very important fact that about 96% of the trials that are being conducted are actually supported by international, pharmaceutical companies, which simply means that as a country, you want to ensure that you have adequate measures in place to protect research participants. And more importantly, you shared with us how the pandemic presented an opportunity to evaluate and even refine your national research oversight system. You shared with us, several lessons that you learned from this particular experience, and also even some of the challenges in terms of reviewing COVID vaccine trials. And when I heard you talking about 6 COVID vaccine trials, I was just saying, wow, that's a huge number. So clearly, Chile as a country has played an important role in terms of assisting in finding solutions to COVID-19. And you also shared with us one of the strategies that you adopted, being the creation of the ad hoc research ethics committee to ensure that researchers would not be dealing with multiple research ethics committees, so that we address the agency in terms of coming up with a solution. So thank you very much for sharing us your experiences as a country related to the COVID-19 pandemic. So now we are getting into the question and answer segment, and I would like to encourage the participants to also include their questions in the chat function. And I'm going to direct the first question to Carla. You actually mentioned that you developed some tools on ethics for the general public. Can you describe to us the various tools that you produced and the types of messages that you were sharing with the public around the topic of ethics? Because I think this is an important strategy to ensure that the public are fully involved and they are aware even of their own rights when it comes to what is happening with public health and research and so forth.
Wonderful. Thank you, Paul. So we developed tools on a number of topics, and one of them had to do with the role of research in the response. And I'm very thankful to PAHO's communication department, because they've been checking what's out there in the media, what topics are being highlighted as problematic, and then bringing them to us so we produce tools in response. But some of these topics we knew, because remember, we had the Zika outbreak in the region not that long ago. We knew that had been problematic before, and before it had been perceived that doing research in an emergency is some sort of distraction. It's something that's morally wrong to do, something you should not be doing. So we wanted from the very beginning to pass the message that research is part of the response and that we can do it ethically. And this is how we do research, and this is how we do it ethically. So we also produced, our communication colleagues also noticed that in terms of implementing public health interventions, there was lack of trust caused by the change in the scientific positions. So we produced a video that explains, I think the title is something like, why do scientists change their views? So that explains that, well, it's not that we're just randomly telling you do A or then do B. We have a reason and there's change, and the change is a good thing, because before we did not know, and as we produce knowledge, we know something we did not know before. So that leads to a change in the public health recommendations. We produced another video on ethical arguments for people to get vaccinated. we were a little bit concerned there was too much of a quick discussion. The discussion went very quickly to legal mandates without addressing that we have as individuals a moral duty to get vaccinated, and that was not being explained for the general population. So I think it was also a good opportunity to explain what moral duties are and how they can get constructed. And the other subtopic on which we did we produce tools is on the involvement of research of children in research, because there was the perception that, okay, it's great to do vaccine research, awesome, as long as they're adults, but children, hold on a second, keep them out of studies. So we produced tools to explain to the general public why we have the moral duty to include children. I mean, children have every right to benefit from science as well. So we have the duty to do research with children.
Thank you very much. And I think those explanations are very, very important. And I'm thinking about the domestic context where we had all this confusion and things were not so clear in terms of what's happening when positions are being changed. Why are they being changed? So it's very, very important to explain how research, goes, and how, researchers and policymakers might actually lead to changes in terms of their positions. So thank you for sharing that experience. And I'm going to direct my next question to Sofia. So how has the research ethics system in universities in Chile changed due to COVID-19? And can you give an example?
Yes, thanks for the question. Well, first, we move everything, including the meetings, to online meetings. And even now that we are without quarantines, we remained with the online meetings because that gives the opportunity to be, we have more participants, more IB members that can join the meeting. And even we have one member that sits in UK now that can share with us her knowledge. Second, we had to discuss which was the proper way to do the signature of the consent form, particularly when there were patients that were having COVID, no one wanted to have papers. And so we have to figure out different forms of having the consent that didn't mean to sign a paper. And but there are some things that we know we have to do and we haven't done it yet, is that have a mutual recognition of what other committees are doing, so that really doesn't matter who reviews the protocol, we trust on them. So that will make really speeding the process. I would say those were the main, and the other important thing, at least in my country, that we really had a public-private joint venture in terms of, for example, vaccine trials. There were protocols running in the private hospitals as well as in the public ones.
Thank you very much for sharing your experience. And the next question, I will start by directing this question to Carla, and then Sofia, you can also even come in. So this question is actually looking at the role of the research ethics committees, including the administrators and the members. So what sort of protections are there for the IRB administrators and also for the members, right? Protecting them from reprisal in the event that they find a proposal or project unethical. So what protective mechanisms are there?
I don't think we have many, and I think that we're talking about we can conceive at least of two very different scenarios. You can conceive of a scenario in which there is fault and a scenario in which there's absolutely no fault, okay? And I think that at least in this scenario in which there is fault, say someone in the committee had for some wrong reason decided to hide a piece of information or didn't do their work or whatever, for some when there's a deliberate approval of something that should not have been approved, there should be some sort of consequence. So, and it's very interesting because we have learned, I don't think we have encountered any case like that. I personally do not know of any case like that. And I have to recognize that we have learned as part of our dialogues, as part of our original experience of exchanging opinions openly with investigators, with health authorities, and with members of ethics, research ethics committees, we have learned that we have a system of in which research ethics committees do a lot of work, assume a lot of responsibilities, and they don't get paid a penny for their work. So going back to what Sofia was saying earlier, we want them to do a professional work, a rigorous work, but it just cannot be charity. And we've learned that the institution of research ethics committee has to be changed. It just we're very thankful for very grateful for the generous time and effort of the members of the committees all over the world. And but I think that it is not fair. It's like unpaid labor. It's not fair. It's a matter of justice. They are an important piece in our system, and they're doing all their work without any recognition. We ought to change that. So that's more like the issue that we've seen. So going back to the other case in which there is some a research study that was not ethical was approved, but without knowing. So imagine the researcher hid some information from the committee. That happens. Imagine the committee was, imagine the committee was lied to, or imagine the committee was perhaps not very aware of something that was being published at the same time they were reviewing the study. There are situations in which a committee can approve a study, and the study in good faith, and the study may be still unethical. But and regarding to this, I want to highlight one issue. We talk too much about the review. We talk way too much about the review, and we do not talk about the subsequent monitoring and oversight of approved studies. We talk about ethics approval as if it be some blessing, right? You get the blessing. Your study is blessed for life and it's going to be ethical perpetually. That's not true. That is absolutely not true. Studies are being done that may show that the intervention you're testing is actually riskier than what you thought. Or another intervention that works can be discovered, or there might be an answer to your research question, in which case there is no ethical reason whatsoever to continue that study. So we have learned that is an area in which that leads to conduction of unethical studies, not because the committees did a bad job deliberately before, but because it's a very fluid scenario, and we produce guidance for committees to do this monitoring of approved studies in the pandemic, because we've realized that a lot of problems the committees were encountering had to do not with the initial approval, but with the oversight, while the entire world is studying the same thing. So, but going back to the core of the question, we have learned that we have some weaknesses in terms of ensuring compliance of sanctions, as it were, at every level, and that we have also learned that when things go wrong, say because an investigator lies, I'm just as an example, okay? This is not truthful to the committee. We also, in our region, we have encountered a problem that ethics review committees are not clear about their role towards society, their duty towards people to say, hey, this is what we're doing, this is what's happening. And I think that the perception that the deliberation of the committees is confidential has wrongly been interpreted as everything that has to do with a committee is secret and unpaid. Thanks.
Thank you, Carla. Sofia, any reaction?
Yes, I would like to comment two different scenarios. One was the situation of ongoing clinical trials not related to COVID. that because of the pandemic needed to have some changes in the way, for example, the clinical controls were done, or use of telemedicine that was not something in the initial methodology that was approved, or sending the pharmaceutical products with Uber or whatever the way that you have to send it at home because people were not able to go to the hospital. And that needed an ongoing review process, not only for the COVID trials, but also for the ongoing trials. And there is something also that for the region is very important, and that we are sort of not really sure how to address, are those studies from the pharmaceutical company that request the sending material to abroad, usually to the United States or Europe. And it's not clear the responsibilities of the center who received those samples in terms of, well, which is the regulation of the biobank? Is it similar to our local regulation? Is it fair for our local people to have their samples sent abroad for different studies? So that's something that I think that at least regional, we should address and have some common ways of dealing with those situations.
Thank you. So in a pandemic, we are in panic mode. And so the issue of using unproven interventions outside the research setting becomes an important one. So Carla mentioned that PAHO has actually issued some guidance document, right? So PAHO is at the center there, but they're issuing this guidance to the countries, including Chile. So I wanted to find out about from Sofia about how you have actually implemented that particular guidance with regards to the use of unproven interventions. And particularly, if you could focus your attention on the collection of data, right, from the use of those unproven interventions, so that even during this pandemic, we can learn from the use of those unproven interventions.
Well, I have mixed feelings with that, because on my experience, first, people didn't know about the MIRI protocol. Researchers at this committee didn't know as well at the beginning. And we had some problems with researchers that wanted to use data that was obtained using unproven therapies, but who received the intervention didn't know that it was really unproven therapy. And they request for retrospective analysis of those data. And the people that used intervention had to pay for that. Specifically, for example, the use of convalescent plasma. So it was tough to try to make the researchers move to a more rigorous way of approaching patients that were critically ill, with whom sometimes you were not able to obtain the informed consent from them, but you needed a proxy for the consent. And to have really a way to put together data, because we have in the country, I would say 10, 20 centers doing exactly the same study with slightly different things, so that make it more difficult to put data together. And they didn't want to talk to each other. So I think that that's a problem, at least what I've seen in my country. I'm not sure the rest of the region.
Thank you. And Carla, your comments on that particular issue?
Well, the situation in the region is very similar. There was no familiarity with the MIRI ethics framework. And I have to say, we went through this Zika outbreak, and this was not an issue that Zika brought to our discussion. This was not discussed at all during Zika. The framework was conceived during the Ebola outbreak, but we had not really I think I had presented it only a couple of times in the region, but it was not known. And if you know, there's something that's a little bit counterintuitive about it, because we're talking about something that's kind of like in the middle between intervention and research. And to the extent that it's outside of research, you would expect Research Ethics Committee or national regulatory authorities not to have anything to do, but they do have responsibilities. And so it's a complex scenario. And I think I must have presented that guidance document, I don't know, over 300 times. I've presented it to Sofia. I keep calling it Florencia. I don't know why. I presented it to Sofia, to Sofia's country, to the Ministry of Health in Chile, and some teams involved precisely on the case that she was discussing, convalescent plasma. And I think that now there is greater clarity. We still need to work on this. And we're also, as part of our work, as part of our upcoming ethics guidance document, we are including this from the beginning in the standard SOPs for emergency mode, as you said. So we didn't do that when we published the templates for the procedures for ethics review committees back in 2020. And having that included there definitely will prepare people for a future emergency. But there's a lot of knowledge and there's a lot of learning that has to take place. And I think that we have to also discuss more openly the underlying issue, which is the perception that in an emergency is ethically acceptable to just ignore evidence and just do whatever, anything flies in an emergency. And that's not right. In an emergency, different things may be ethically acceptable, but there's some ethical guidance for those things too. And we need to clarify that.
Thank you. So, Sofia, globally, we've been complaining about how inefficient the research process is, right? And the pandemic actually, presents us with an opportunity to refine our processes. And I liked the strategy that you adopted, the use of the ad hoc committee. So the question that I have for you is, what were some of the challenges with the use of that ad hoc committee? And is this going to be a permanent feature now that we are talking about preparedness for the future, pandemics?
I would say that the biggest challenge from my point of view is to get to work together a group of people that have never met before and that have different views regarding how to protect research subjects without hampering research enterprise. But after a couple of weeks working together, we were able to speed up our way of agreement on general issues. But I'm not sure if having this ad hoc committee, it's a long-lasting strategy that could be maintained after the pandemic, because what I perceive from my country, that each committee is very empowered, to have their own review process, but having frequent meetings organized by the health authority, they feel that is something important because it gives them the opportunity to raise their capacities. So I would say that that is a strategy to raise the capacity of the research ethics committee, having more webinars, and having opportunity to share, for example, small research ethics cases to be discussed, and that will be something probably useful. I think so.
Thank you, Sofia. So now I'm going to give Carla 1 minute to give some parting shots. And Carla, I would like you to also share in that 1 minute what you are doing to share your experiences with other regions so that other regions do not have to reinvent the wheel. You had lots of interesting lessons for the other regions. So 1 minute.
Wow, Paul, that's hard. So I'm part of WHO's ethics and COVID working group. We meet regularly and we do some sort of update of what's going on. And I try to communicate more often with my counterparts in other regions about the work that PAHO is doing. And we will have a meeting I think this month with a specific goal of sharing not our COVID work, but our work on strengthening research ethics systems using indicators. There's certainly room to do a lot more. But I have to say that we're lucky at the region of the Americas because PAHO has a regional bioethics program that got established in 1993. So, and there's no similar program in other regions. And that's actually 10 years before WHO established their ethics unit. So we're lucky to have that long history, and we should definitely do more to involve other regions. I've shared the link to subscribe to our research ethics mailing list. You're all welcome to be part of that. It's not restricted to the region, even if there are many activities that may be of greater interest of the region. Thank you, Paul.
Thank you. And Sofia, your parting shots.
See, I have been lucky to participate in the COVID-19 ethics working group, where I have met colleagues from different parts of the world. And one of the main lessons that I have is that this problems that we think that are unique to my country are shared everywhere. And that when we start talking about which are the difficulties, for example, vaccine trials in children or in pregnant women, they were all facing the same questions. So I think that the global initiatives are quite important and they should be maintained after the pandemic.
Thank you very much, Sofia. Thank you, Carla. Thanks to everyone for being a part of this wonderful webinar. Our two colleagues have shared very interesting experiences that we can all learn from. So I want to thank you all for participating in this webinar. We look forward to having you again during the next webinar. So we're going to circulate the flyer in due course. So from me, Paul at GW, it's a goodbye to you all.
Bye.
Bye.